Lafayette General is a not-for-profit, community-owned health system. The owners of Lafayette General are the people of Lafayette and Lafayette Parish.
A community-owned nonprofit is really a force for good. Just as a community is composed of citizens from every walk of life, so is a nonprofit, community-owned hospital. We're here to restore, maintain, and improve health. We touch the lives of virtually every family in Acadiana. We understand the voice of the patient, the voice of the families, and so we work really hard to be successful financially so that we can be the safety net for the community, so that we can provide care, most importantly, for those who can't take care of themselves.
Our profits, or our excess margin, stays here in the community. It's not sent to Baton Rouge, it's not sent to Nashville, it stays here in Lafayette. That money is used for our facilities and new technology. It's reinvested. From the moment you choose Lafayette General, you ensure that high-quality care and cutting-edge technology remain in our community.
Acadiana is the most wonderful place. It has everything. It has a joie de vivre. It has a sense of community, a real sense of family. Instead of getting ahead of the next guy, we're happy for each other. And so it's a perfect place for a health system.
Lafayette General owns and manages several hospitals. Our goal is to provide great care here in Lafayette, but our other goal is to have an approach where we're helping the smaller community hospitals be successful in their communities.
Take your time. Being a part of Lafayette General Health is like being a part of a larger healthcare family. If ever we have a question about how to take care of a patient or a protocol for a certain diagnosis or illness, it's just a matter of picking up the phone and consulting with anyone at Lafayette General, and it's having that connection to take care of the patient in the best way possible.
We want to go and help those hospitals in the smaller parishes. We need for them to provide great primary care, and we're helping them in a variety of ways, whether that's service lines such as neurosurgery or cardiac surgery.
When patients come to our small rural hospital, they're actually stepping in to Lafayette General Health. They don't have to drive to Lafayette to see specialists, to go to the emergency room. It provides us an opportunity to give them the technology and the quality of care that they would receive in Lafayette close to home. And that's really what makes the difference.
Lafayette General continues to push the envelope, and really this passionate pursuit of excellence that we have is what drives our success. And that's why we want to create a great place for graduate medical education here in the community. We have now a vibrant culture of education, which is something that we all want to see in healthcare.
Education, by its own right, stimulates both the students, the residents, along with the faculty and nurses. And studies show that whenever you integrate medical education into a community-based hospital, the quality of care goes up, along with patient satisfaction.
What I love the most about being a resident in a teaching facility is that you always have a constant learning opportunity. Having that family of physicians and residents and students, everyone is just learning things from each other. I chose to do residency here and be here because this is the people that I want to treat. I forever want to be in Lafayette, and I'm very excited that the opportunities for me to learn are so close to home. If I had to be in Michigan to train, I don't know what I would do with myself. The opportunities that have been provided here are just astronomical.
For us to have good community doctors later, we need to have physicians that are trained within the community that we live. Amongst the primary care residents that are trained at UHC and now LGMC traditionally, we have about an 85% stay rate within the community around us. So both in academic medicine, you get your education component, you get the influx of physicians within the community, and then also with that, you get quality patient care for those that need it most.
As a healthcare leader, I never want to be part of an organization that is reactive. I always want to be part of something that is proactive. Our goal is to make sure that we're staying on the cutting edge of technology. And so each year we're looking at various service lines and adding that technology which will keep us state-of-the-art with what's happening in some of the best hospitals in the country. Lafayette General's mission is to restore, maintain, and improve health. And in order to do that, we have to constantly be looking at what are the new innovations that are happening in healthcare. With our Lafayette General Health Foundation, we focus on an innovation fund. And so the foundation is a central part in how we invest in new technology. As a living lab, the community takes care of each other. They can not only invest in our facilities, make donations to our facilities, but also invest in the way healthcare is delivered, not just in Lafayette, but across the country.
Lafayette General is the greatest charity you've never heard of. Imagine in a community, an institution that employs over 2,000 people, that delivers over 60,000 emergency room visits a year. It's a place that's a shelter from not only the physical storms that we receive in South Louisiana, but the storms in people's lives. It's a place where we celebrate the joy of the newborn, where his first cradle is. It's a place that focuses on restoring and maintaining and improving the lives of people in Acadiana. And it's also a place that, for all the technology, for all of the brilliant minds, and for all the networks of care, it is, at its essence, one human being caring for another in need.